My name is Christina and I'm a student clinician. This is my patient. What's your name?
I'm Liana.
Hi, Liana. Hi. Today I will be assessing Liana's swallow. So, just to start off, I'm gonna ask her a few questions about her current condition and also why she's here. And I'm gonna do a really fast little cognition test, some oral motor, and then we'll start with our swallow evaluation. Okay. So, Liana, tell me why you're here.
Sometimes I aspirate on water when I drink.
Oh, really?
Have you had coughing? It makes me uncomfortable.
Have you had a chest X-ray done or a CT scan? Is there any infiltrate in your lung?
No, I don't think
you just sometimes choke on the water.
Just I notice I choke on the water.
Okay. Okay. Is it usually when you choke on the water? Are you also eating at the same time, or just by drinking water?
Depends. I didn't pay much attention when it happens.
Okay. So, do you know why you're here?
Yes, I'm here for see if everything is okay with my swallowing.
Okay. So what day is it today?
Today is July 11, 2019.
Right. Okay. Is it a Monday?
No, it's Thursday.
Thursday. Okay. So, have you had any history of aspiration pneumonia?
Not that I have known.
No? Okay. Okay, so I'm going to give you 3 words to remember, okay?
Okay.
The first word is blue, sock, and bed. Okay? Blue is a color, sock is a clothing item, and bed is furniture. Okay. So what are the 3 words?
Blue, sock, and bed.
Perfect. Okay. So she's alert and oriented. She knows why she's here, the day, time, year, and she's oriented to herself. So, and remember those 3 words. I'm going to ask you at the end of our session, okay? So now let's get started with some oral motor exercises. So just want to check to see how her tongue strength is and if she has any range of motion difficulties. Because when the oral muscles or when the oral muscles have trouble, then sometimes swallowing disorders also come through. So we want to make sure that her oral muscles are functioning correctly. So if I can have you open your mouth, stick your tongue out, say ah, ah. Can you say ah, ah, ah? One more time. Okay, I'm just checking to see if her velum elevates. Now stick your tongue out, push against the stick. Good job. Okay. Tongue out, up. Good. Down, left, right, back and forth. Good. Inside your cheek. Okay, now check. E. Ooh. E. Ooh. Good. Now open your mouth. Say ah, ah, ah. Ah, ah, ah. Say pop, pop, pop. Pop, pop, pop. Good. Okay. So her lip muscles are functioning good. Her tongue strength is within functional limits. So let's get started. So I'm gonna start with the nectar thick liquids because I want to make sure that I want to start with the least restrictive and go to the most restrictive. The least restrictive for right now will be honey thick because it's heavier, so it'll glide down slower just in case she does have any swallowing difficulties, and I don't want to risk aspiration at this time. So let's try with our honey thick. So honey thick liquids by teaspoon. Make sure she's good with by teaspoon before we move on to by cup or by straw. So for all the trials, we're going to first try by teaspoon, and then by cup, and then by straw. So, and if it's okay, I'm going to put my hand on your throat. I want to feel her laryngeal lift. Okay. So this is honey thick by teaspoon. Open your mouth. Good. Say ah, ah, Okay, I want to make sure that her voice is not wet and the liquid hasn't gone down the wrong path. So if I can have you take a sip. One sip. Okay? Okay. So she has previously chalked on thin, so I don't want to start with thin. I started with nectar, make sure moving along the right way. So now let's try nectar. So she's good with honey. She's good with honey things. So now we're going to try nectar. I'm going to give you a teaspoon of nectar. Open your mouth. Say ah. Good. Okay, now we're going to try nectar by straw. So honey is a little too thick to try with straw. So we're going to try nectar by straw. Just take one sip. Good. That's a smooth swallow. Okay. So we're good. Now we're going to move on to thin. So she's good with honey. She's good with nectar. And she has not cleared her throat or coughed. So I feel that it is safe for her to try thin liquid at this time. This is thin liquid by teaspoon. Okay. Do you feel any pain when you swallow?
No, not really.
Okay. Okay, can I have you take continuous sips, like you're drinking water and you're really thirsty? Okay. Now open your mouth. Say ah. Good. Okay. So everything is really timely. I can see that her hyolaryngeal lift is good. Her swallow initiation is good. I don't see any spillage. Her labial seal is good. It's appropriate for spoon, cup, and straw. So, for now, we're gonna try water by straw, and then we'll move on to our solids. Good. One more sip. Do you feel like going down the wrong path?
No, not this
Okay.
time.
Okay, so maybe that's just one-time thing that, okay. Okay. So, now we're going to move on to our solids. So, we have our puree, graham crackers with puree will be our ground, and then we have chopped. And then the graham crackers will be our mechanical soft and regular. Okay, perfect. Let's get started. So we're going to start with puree first, which is the least restrictive. This is a teaspoon of puree. Good? Okay, let's try one more. Okay, open your mouth. I'm checking to see if she has any residue or excess food left there inside. Now say ah. Okay. So she's good with puree. So I'm gonna grind up the crackers a little bit. Open your mouth. Good. So her tongue is clear, which shows that her tongue works fine. She's able to clean up her oral cavity, and there's no residue. Good. So I think you're ready. I think you're ready to try chop now. So I'm gonna try chop now because she hasn't had any trouble with solids before, so she should be fine. Open your mouth. Good. All right. Let's try mechanical soft. So I'm just gonna okay, try to take a bite. Okay. Here you go. You can eat this.
Oh, thank you.
Okay, let's wait till you swallow. Open your mouth. Okay, try again. So you always want to make sure you take small bites and you eat slowly. Don't rush. Maybe alternate with some liquids. Do you have any left in your mouth? Good. It's all clean. Okay, so you're good to go. So I'm going to put Leanna on a thin liquid diet with regular texture food. She is able to provide correct labial seal. There's no anterior spillage. Her bolus control is fine. Oral transit's fine. There's no oral retention. The swallow initiation's fine. And her laryngeal lift is appropriate. Also, always make sure you take small bites when you're eating. Alternate with solids and liquids. Sit up straight, and then sit up straight when you're eating. Also, sit up straight 30 minutes after, just to help things. And if you need to do multiple swallows, go ahead. That is totally fine. But yeah, I think that's good. Do you have any questions for me?
You're gonna ask me about the words.
Oh, that's right. Yeah. What are the 3 words?
It's blue, sock, and bed.
Have you been thinking about it also?
Yeah, I tried to keep it in my mind.
Okay, well that's good. So looks like her cognitive skills are intact as well. Better than my skills.
No.
Okay, well we're all done for today. Thank you for coming, and I wish you good luck on your recovery. Okay.
Thank you so much.
Okay.